Today I'm presenting from the Salt River Fields here in Scottsdale, which is the new spring training home of the Arizona Diamondbacks and the Colorado Rockies. They used to both be down in Tucson sharing a field, but all the other teams are up here in the valley. So 2 years ago, the deal was struck with the Salt River, Pima, Maricopa Indian community, and they started construction in November of '09, and they finished just before spring training this year, and this is the absolutely gorgeous result. There's 12 practice fields. There's an 11,000 seat stadium, which is right behind us here, and there's beautiful office space for both teams. Right across the highway, which is behind the whole project, is the Talking Stick Resort, which is also a project by the Salt River, Pima, Maricopa Indian community, and they have a Casino Arizona in the resort. One of my other topics discussed the history of that. This whole project cost around $100 million, and to me it looks like it was money well spent. The topic for today is medical marijuana and its effects on nausea and vomiting. The first question is, does it work for nausea and vomiting? And the answer is absolutely it works. It's the longest standing usage of medical marijuana, or marijuana in general, is to prevent or deter the effects of nausea and vomiting. So what conditions is that useful for? Well, let's say a patient is undergoing cancer chemotherapy, which is a horrifically toxic thing to do to the body, but it helps kill the malignant cells. But one thing that it also can do is create terrible nausea and vomiting for patients. So much so that when a patient is going to a facility to get their chemotherapy, it can create a conditioned response that the patient can start to get nauseous before they even get to the facility to have their necessary treatment performed. Another condition where it's very common to have nausea and vomiting is for treatment of HIV or AIDS. When a patient is undergoing antiretroviral treatments, it can be extremely disabling for patients as far as nausea and vomiting. And what can this lead to? Well, if it's a continual problem, patients just don't want to eat anymore. And also they just start to lose weight because they can't keep anything down. So it can feed on itself. And you're fighting a condition where you need your immune system and you don't really have it because you can't get in the nutrients to protect your body. So it can feed on itself and be a terrible situation to face. Marijuana can be extremely helpful for that. Back in the 1970s, when chemotherapy first began to start being utilized, they started to see the effects with the nausea and vomiting, and patients started to realize that marijuana could be very helpful. So in the early 1980s, six states began doing studies on the effects of medical marijuana on nausea. No, Arizona was not one of those states. Yes, California was. And all 6 states found that there was a positive effect of marijuana decreasing the nausea and vomiting, allowing patients to eat better, stay more hungry, and either gain weight as opposed to losing weight, or slow the loss of weight from their conditions. So back in 1986, the FDA cleared a medication called Marinol, which is a synthetic THC, and it's one compound, one THC. You know, marijuana itself has a lot of THC and other components to it. So the one compound is in Marinol, and it's an oral medication, and it has shown to be effective for nausea and vomiting from debilitating conditions. So it's still in use today. Well, why is it that patients sometimes veer over into utilizing smoked or vaporized marijuana as opposed to simply using Marinol? Well, the answer, from what I'm gathering, is that there is a much more consistent response or dose-response effect from the smoked medical marijuana as opposed to Marinol. Ingesting it can take maybe 2 to 4 hours to take effect, and the effect will then last maybe 4 to 8 hours. So the length of duration, the duration of treatment is there, but the onset is a problem. If someone smokes or vaporizes marijuana for these conditions, the effect is felt within minutes, and it lasts for 2 to 4 hours. So supposedly it's a much more consistent type of response. Additionally, as mentioned, there are a lot of other THCs and components in smoked marijuana. So for instance, there's an anti-anxiety effect, from smoking marijuana that has also been reported to be very helpful for patients who have nausea and vomiting. I mean, think about it. If you go to get your chemotherapy and you have that conditioned response of where you know that you're going to get nauseous, or you're getting nauseous even before you get in the door, that's a problem. Because now you're not talking about the effects of the chemo or the HIV medications themselves. It's just a conditioned response that turns into a physiologic problem. So that is one of the reasons that it can be very helpful as well. There have been studies to back up these effects. There was a study in the New England Journal of Medicine back in the 1970s looking at 20 patients who had these types of problems with the nausea and vomiting. They randomized them to placebo versus smoked marijuana, and the ones who utilized the smoked marijuana had very low side effects and very efficacious results as far as decreasing the nausea and vomiting. So there you have it. It is very effective for nausea and